So welcome everybody to the Staying Aligned workshop. I'm Dr. Karyn Staples here to present both the shoulder, the hip, and the ankle. So we're going to start with the shoulder today. Each element of the workshop we're looking at what is congruency, what is this element of this ball and socket joint that we're going to talk about, the idea of defining congruency and why is it even important, looking at incongruency as well as out, and what's the difference of different layers of what's important and what focuses on that sense that somebody is actually having that congruent shoulder, hip, or foot and ankle. We're going to be looking at different body positions, both lying down, seated, and standing, and we're looking at exercises on both the reformer as well as on the mat. And then the bottom line with each of them, we're going to go back to that basic principle that Joseph Pilates has is breathing. So we're going to look at that with each and every joint, just because that's our basic foundation of life. It's also Joseph Pilates' basic guiding principle. So the first part is the shoulder complex in motion. The shoulder complex is really complex, and which sounds very simple to say, but there's a lot going on. So we're going to look at these ball and socket joints, and it seems like we're taking the most complex one and going down the line and also going down the line of the body. But knowing that that shoulder itself has a lot. We have a lot of freedom of movement in our arm, and that's important, and that's really what allows us to be able to get through our day-to-day and be able to have this dexterity of our hands. So how is it important, and why is it important for this ball and socket joint to stay in alignment? So we're looking at the anatomy of the shoulder. So the glenohumeral joint. So the glenohumeral joint is the actual ball of the arm bone on the socket of the shoulder blade. So it's like a golf ball on a tee. So a very large ball on a very shallow socket. So there's a lot of structures that can help to keep that aligned and do help, but in all intents and purposes, it's all about balancing this little ball on this tee. The glenohumeral joint involves both the humeral bone, so we're looking at both the long arm bone here, as well as the shoulder blade. So the big thing about the shoulder blade, and this comes from Dr. Brent Anderson, just as a reminder that the scapula is shaped like Africa. So it kind of gives you that whole sense, and most people know what the continent of Africa looks like. So it makes it very easy for somebody to know, oh, those triangle bones, oh wait, yeah, they sit on my back. And just to understand that concept that we have this nice triangle sitting, and we have two of them on our back. The big thing I want you to notice on the arm bone, the humerus, and you can see it in your pictures as yours is a little bit in that closer part, there's a nice spiral of that bone. So it's not a straight shaft, and that's probably one of the important things to remember for your humerus, for that arm bone. It's not straight up and down. There's a sense of spiral around, and that's important because that's how the muscles can attach and how the other structures attach to allow for that movement and that freedom of movement of that arm bone. There's another joint that a lot of people forget when it comes to the actual shoulder complex, and that's the scapulothoracic joint. So knowing that most of the time we think of joints lining up together and touching one another and having this sense of connection, but the shoulder blade floats on top of the rib cage. And that's an important element, is that we need that float. If something's up differently in that thoracic area, that rib cage is a little bit elevated, something's not quite lined up right, it's not going to allow for that same glide of that scapula. So knowing that that postural element of how somebody is aligned is going to make a big difference to the scapulothoracic joint, which then has an element onto the glenohumeral joint. So it's the whole adage, the foot bone's connected to the knee bone, connected to everything else. So this is that element within that shoulder blade itself. And then we have the other joint, the sternoclavicular joint, and that's that joint in the front. So where we have the collarbone and the sternum connecting right in the front of the body. This is the only place that this entire shoulder complex is bonally connected to the body. So if you didn't have this connection between the collarbone and your breastbone, we would be able to take our arms off like shoulder pads and then somehow try to wiggle in them in the morning. But the element, they're bonally connected here. So there's a lot to be said of this connection all the way in the front of the body. So that's the only connection for this shoulder complex to the axial skeleton. So now we have to look at how does the shoulder itself work. So this kind of goes through my statement that I just said that got from Kara Reeser. But the biggest thing I want you to realize is what happens as your arm moves. So just reading right in here, the shoulder blade stays quiet the first 30 degrees of elevation. So 30 degrees is about here. So it's 30 degrees about there, 30 degrees is about here. So meaning the shoulder blade doesn't move at all. It just stays on the thorax. Then for every 2 degrees of the arm bone moving, you have 1 degree of the scapulothoracic movement. And that's an important part because the shoulder blade has to move as your arm moves further away from your body. But the quality and how that movement happens is what's important. So the shoulder blade can move up, it can move down, it can come in, it can come out, but it also can swing. And that's what we want to see. We want to see the swing of that scapula on the thoracic spine. Not so much in elevation, not so much of this sense there's an element of the shoulder blade moving around the body, but we don't want too much of that. It's that 1 degree of movement is the element of this swing, just like a pendulum on the body. So that's what's important for the scapulothoracic. And it's hard to say 2 degrees, 2 degrees, 1 degree. That's really small. I mean, even if I got a goniometer out, it's hard to even measure that distance. But there's still some. So you have to go through. The person gets a little bit out here. So if we're just working on the 100, right in here, there should be really no scapular movement if we're doing the 100 by our sides. That scapula stays relatively quiet. But then as we do 100 and we want that person to be bigger up and down, there's going to be some scapular movement. But it should be this nice little swing versus a up and down, which we see often in people move. They tend to be much more of a elevator of the scapula. They think that's going to help them, whether it's supporting their neck, doing something else. They just are breathing this way, something else, but knowing that we want to see this swing. And we're going to practice that in just a few moments, just to feel what that feels like. The other element of arthrokinematics is that normal is relative. So somebody's shoulder may move a little differently than somebody else's. So there's not an element of, okay, it always moves like this. Everybody's shoulder always moves like this. That's why it's nice to kind of get your hands on several different people so you know what their normal is. What we want to make sure of is that there's not a lot of one side going and then another side kind of follows along. That we want to have both symmetry in the movement of the shoulder blades as well as the movement of the arms. So if we have one arm that seems like it's going and another one it's kind of going and it feels very jerky, then we're more concerned about that jerky one. Why is that one jerky? The important thing about the shoulder as far as range of motion, the shoulder has a lot of mobility. We can raise up to the front, to the side, we can go to the back, and then we have the ability to rotate. We only have 180 degrees total of rotation. So if you look at a baseball pitcher that can really bring their arm way back, and instead of being at 90 degrees of external rotation, they have 120. That means they're only going to have 60 degrees of internal rotation. So that's one thing you have to watch on some people. If you see that they're super flexible, that their arms can go way back, and then you're like, wow, you're really tight this way. Is it really a tightness there, or are they just at their limits? Because we only have 180. That's all that we have available in that structure. So when we give up on one side, we have to give up on the other. And then the other element comes from Arthur Vleeming, and the scapula is the kneecap for the pelvis. So the shoulder blade, just like we have a kneecap on our knee to allow for that good glide of all the muscle tissue and allow for that knee joint to move appropriately, the shoulder blade does that for the pelvis. So we talk a lot about this interconnectedness of the body. I'm separating these joints out a little bit today for us to look at individual parts, but in the grand scheme of things, if the shoulder blade doesn't move well, the pelvis might be unstable. Or if the pelvis is too stiff, the shoulder blade may not move well. So the two go together, knowing that we have a lot of structures that attach from one to the other. So just kind of thinking of that to know where those connections are. And then as we get to the hip, you understand it's like, oh, wait a minute, the pelvis is the socket for the hip. So now we've just connected the shoulder and the hip in just one element right in there. So how does that ball stay on that socket? So how does that golf ball stay on that tee? And we have a bunch of muscles that connect with it, and the biggest muscle group that stays, that keeps that muscle, that ball on that tee, is a rotator cuff. So your first slide here, that's showing the subscapularis muscle. And the subscapularis is on the front side of your shoulder blade. So if you take your hand and you kind of come into your armpit a little bit, you're along the side of your rib cage and you let your fingers kind of poke back, you poke right onto that subscapularis. And if you're not sure, if you take your hand and try to go into what's called internal rotation or diving that hand down, you'll feel it tighten. That's what that muscle does. But it covers the entire anterior portion of the scapula, the entire anterior portion, which is a big thing to say because on the back side, it takes 3 muscles to cover the same area. And partly the shape of the shoulder blade puts that in the case, but also where the spine of the scapula is. So we have this element of the supraspinatus, which is above the spine. So that's probably one of those easy muscles to remember. It's above supra. Then we have infraspinatus, which is going to be the one right below the spine. And then we have the teres minor from there. So those 3 in itself take up the same amount of space, that the subscapularis does on the front. Now, the whole reason we have a rotator cuff, most people think it's to rotate our shoulder, but really the main reason is to keep that ball in the 1 centimeter center of the glenoid, which is huge. I mean, the idea is that we have this sandwich around that humeral head to keep that ball in that center. That's its main job. So if something is off, we've got a tear, we've had an injury of some sort, we have a lot of weakness for something, all of a sudden, one's going to pull differently than the other, and now we're no longer in that center. So the idea of that golf ball staying on that tee, we have other non-contractile tissues that help, but this rotator cuff is really important to keep it in that center. Then we look at the muscle called the trapezius muscle. So with the trapezius, we generally, in anatomy purposes, we split it up into an upper, a middle, and a lower, mainly too because we have some different nerve fibers innervating it. But in the grand scheme of things, it's one muscle that's very, very thin. So if you ever did any dissection on a human anatomy cadaver, you'll notice that it's super thin. It's not a very big muscle, but it gets blamed for a lot of stuff. So it's not able to kind of control that shoulder blade, but it attaches both to all the way up to the skull, and it attaches, if you look down below, it's attaching into that upper lumbar region. So it's actually attaching to the thoraco-dorso-lumbar fascia is what it's attaching to. But so it's very broad and a very flat muscle. If it's coordinated well all along, it'll help to control that extra movement of the shoulder blade and make sure we have a good glide. If it isn't balanced top to bottom, then you're going to have some abnormal movements happen. So then we're going to see our extra elevation or something because the upper trapezius area tends to work a little bit better than the lower trapezius, especially when things aren't lined up well. So looking at what is shoulder congruency. So the definition of congruency is the optimal alignment of the humerus in the glenoid fossa to provide efficiency and accuracy of movement. Well, that's a lot of fancy definition terms. The idea is that we want to move well. Our body is designed to move well, and that's an Eric Franklin quote. So our human body wants to move well. So how do we do that? The better aligned we are, and we see that when we watch people move or we look at people even walking down the street. You look at some people with their posture, you're like, man, no wonder they're out of breath. They're just really having to labor to get from point A to point B. They're just not using their body appropriately. But the idea of that congruent joint is that it does have that efficiency. So if it's lined up well and it's balanced, it'll be efficient. We use less energy and we can get the task completed. The importance of shoulder congruency is really for that dexterity for our hand, that we want to be able to know we can interact with our environment with our hands and being able to interact with the environment with our hands to do it well without feeling that extra load someplace else, that it's super heavy. So that we all know for physics that the longer my arm is out here, if I put a load here, it's a lot heavier than if I put a load here. But how efficient can I be with those loads if my shoulder's not in the right alignment? So knowing that if it's better aligned, I'll be more efficient from there. So we have these elements of how your skeleton affects your alignment. So we've all heard, you know, sit up straight. So sit up straight, love mom here. But if our skeleton isn't lined up well, we can't have that congruency. So we've talked about some muscles that help with the shoulder, but looking at where that alignment is. So the pictures are of my client Sandy, and she knew she was getting pictures taken for this purposes, so she did approve. So this shoulder, you can tell, in this shoulder, you can see where the humeral head is. If I take my hands right in here, you can see right in here how that humeral head is a little bit forward of where this side seam of her shirt is. So that's showing that that humeral head is sitting forward in the socket. Now if I flip to her other side, now you can see how it's sitting more in line. So her shirt went back this way, but this is her straight line. You can see how her humeral head is sitting much better on the other side. So she presents with scoliosis. So she has some structural changes in her thoracic spine that causes that one scapula to no longer sit as well as the other one. So then it causes the shoulder to round more forward. So it's an easy person to kind of show differences because she has a structural change. So I'm not fixing that structural change, but trying to optimize that structure and optimize her alignment to make sure she can be efficient with her movement. But looking at that alignment from there. So what I want everybody to do right now though is take your hand along your collarbone, and as you walk your hand along your collarbone, you're going to come all the way on out and you're going to feel the end of that collarbone. You're going to feel where it attaches to the acromion process of your shoulder blade. So that alignment there. Now when you take your hand down, you come down and you come right onto that humeral head. So if your hand is by your side, so elbow just kind of resting by your side, that humeral head should sit straight in the middle of that point. So I already talked about earlier that we have that alignment of the collarbone with the breastbone, so that sternoclavicular joint. That joint is fixed. So when we come around in here, that joint right here is fixed here, and it helps to set what that humerus is going to do. So if somebody is sitting and that humeral head is forward, you're going to know it because it doesn't line up with that point anymore. If their humeral head is too far back because they're one of those people that think they need to walk with their shoulder blades back to keep good posture, then you're going to see that that humerus is behind the midsection. So we have our skeleton to give us a cue as to where that person should be lined up. So taking somebody that just having them stand up, so let's have everybody stand up for a moment. And you're going to allow your hands to just be by your side. And if you let your hands come to the front of your legs, just feel where your arm bone kind of feels like it lies. It should feel like it's forward. Now if you take your hands to the back side, so your thumbs are kind of behind, now you should feel like, okay, yeah, my shoulder blades had to come together a little bit, but my shoulders feel like they kind of came back a little bit, potentially. Now some of us might have some other tightness. But now just gently let your hands rest on the side of your legs. And that's our ideal alignment. This usually helps to keep for somebody, their humeral head is sitting in the middle of their socket. Now just rotate your hands so they're palms forward. And when you rotate them palms forward, it might actually make you feel like, ooh, I'm actually better. Like I feel better aligned. Now from the elbows down, let those hands relax. And that upper arm bone should have stayed. So a lot of times people think what the forearm does, everything has to follow. But if we take somebody even lying down and have them start with their palms up, we tend to align them well for the shoulder, and then reminding that client, okay, you do have the ability to rotate in that forearm separately of your shoulder. And then just being able to do that. Now, it shouldn't take a lot of muscle to hold it there. You shouldn't feel like your shoulder blades are squeezing. You shouldn't feel like you're having to hold really hard and you can't breathe. It should just be that skeleton just feels like, hey, this is good. I want to be here. Okay? There's been a lot of research, and it continues, on posture in general, how we're lined up and what that does. Amy Cuddy, and I have the link on your page, Amy Cuddy did a really great TED Talk several years ago, and it was all about posture and mood. So she's a sociologist. She's not an anatomist. She's not a Pilates teacher. She's a sociologist. And so her element of her research was looking at hormone levels. So she looked at testosterone levels and cortisol levels. So cortisol levels being our stress hormones. Testosterone, yes, women, we do have it. But testosterone levels being that sense of like power, that I'm feeling good about myself. So she tested people before, then she had them sit in a position or stand for 2 minutes. So the high power positions were something like this. So you're standing with your hands by your side. So those that remember Wonder Woman, this is how she would, after she would turn in her costume, she would stand there nice and proud. So they'd stand there for 2 minutes. And after staying there for 2 minutes, she would retest them. When they retested, testosterone levels were up, cortisol levels were down, which meant they were less stressed and they were more ready to go into whatever activity they were going to do. So in her mind, she said if you have a big test, a big presentation, anything like that that you might feel a little nervous for, take 2 minutes and get into your high power position. Because then she tested a low power position, which think of it as being slouched in a chair, just kind of that rounded, just kind of think of that person that in the corner that's not really wanting anybody to approach them, please don't look at me sort of thing. 2 minutes, after 2 minutes being in that position, cortisol levels went up, testosterone levels went down. So their stress level actually increased. And that was just from posture. They didn't take anything, they didn't do anything else, only posture. And that's what she was checking. So then there's other people that have looked at the idea of how do we look at our posture and what does it do? So just kind of sitting in the chair, I want everybody just to kind of let themselves slouch. So think that you're a nice little teenager, you can lean over or whatever. And then, so we already got a teenager in the room. I promise she doesn't sit like that all the time. So now I want you to go ahead and try to smile. Okay, now sit up nice and tall. Think about taking your pelvis, your rib cage, and your shoulders, and everything is stacked up. Now try to frown. It is even harder. So the idea is that happy people have better posture, but knowing that as people are in the good alignment, it's a lot harder to be sad. So if somebody comes in, and there's a lot of times that I know as the other therapists and medical providers in the room, somebody might come in and even come, somebody comes in for movement that day and they've heard some sad news or they just don't feel well. They kind of come in and they're kind of like, oh. And then they're kind of like, I made it. Like, don't I get a gold star? I arrived. I mean, and then you start moving them on the equipment and all of a sudden they start smiling or they start talking about something or then they leave. They're like, wow, I'm so glad I came. I feel so much better. And so then they go off and then it's like, hey, see, that's just like a nice walking advertisement for your studio, for what services you provide. But there's a lot to be said about moving somebody and getting them feeling better. And the idea people do want to move, they're just afraid it's going to hurt. And if it hurts, they don't want to do it again. And then it just kind of builds from one to the next. So the better movement we give somebody with less pain, the better they understand about how they should align themselves up, then all of a sudden they feel better and they think you're a magic. And they're like, how did you do this? How did you know this? How did you know that that's what I needed? And it just comes down to those bottom fundamentals of what are our building blocks of movement? What are our building blocks of our body? The idea of that where our body is when we're sitting, we have this effect on both the front of the body and the back of the body. So the longer we sit, and there's all sorts of TED Talks and other things about sitting is the new smoking, different things of our posture affecting sitting. But the biggest thing with sitting is how long we sit now. And I have you all in chairs, I know. I'll be moving again. But the idea of sitting, that the longer we sit, the more it is detrimental not just on our skeletal system, but on the rest of our system. Because potentially people aren't breathing well. And we want to make sure we're breathing well. We want to make sure that things are aligned well and our body wants movement. Our DNA craves movement. So we want to be able to give our body that movement. We switched from being a standing society. There's a lot of research on too much standing and how many injuries that caused. And some of it comes down with where the industry was at the time. And then we switched to being much more sedentary society. And at times, if you look back in history, the sedentary society were the royals. And generally, if you look back in history, they were also the people that were a little heavier because they didn't have to do anything. They were well fed, they had all sorts of things given to them, they didn't have to do much other than make decisions and make sure that people followed their directions. So now we've kind of created a society where it's not that we don't have to do anything, it's just the things we do don't require a lot of extra movement. So Dr. Levine has said years ago, for every 8 hours we sit, you would have to do 8 hours of activity to counteract your 8 hours of solid sitting. So then the suggestion is, okay, don't sit for 8 hours straight. And that as you're sitting for an hour or two, that you're getting up and moving. So now we have the sit to stand desks and other things from there, but knowing that we want to make sure people are moving. So that's what I love about what I do for a living, is that I don't have to sit all day long to do what I do. The last part on this posture, the cue, draw your shoulder blades down and back. So what I want to do is I'm just going to turn around and show that if I said to somebody, draw their shoulder blades down and back, this is what they would do. So look at the change in my back and look at the change in my arms. I really can't even move my arms very much. I can fly them around a little, but I don't have much range of motion. So I've basically taken my shoulder blades and locked them in the exact opposite direction of what I want, and I've hindered the movement in my shoulder. And with that cue, I've also potentially put an impingement on my rotator cuff. So I've set up a system of putting more strain on that area. Now, it makes sense if somebody's walking around like this to give them a sense of relax your shoulder blades, allow your shoulder blades to lower. The big thing is I know that anything in any sort of world that we've been in, it's always good cues gone bad. Somebody takes something and they're like, ooh, that's what I have to do. It goes back to the same thing with a squat. Years ago, people would squat and they would always be, it's too much on your knees. So then they tell somebody to sit back. And then it became, I'm going to sit back. And then all of a sudden, everybody's squatting and they're feeling it in their lower back and they're no longer feeling it in their leg muscles like they should. So looking at that individual, so as a blanket, I try not to use in a big group setting, draw your shoulder blades back and down or down and back, because it ends up being that people will overcorrect, because you're going to have your people that want to follow exactly what you say, and they're going to be really good at it, and they're going to do a very, very good job. And then they're unfortunately potentially going to be moving in another way. So trying to make sure that your cues that you're giving to the group or to that individual is going to give you the result that you want. So knowing what does that shoulder blade down and back do? What am I getting from that? What am I layering in or locking in from there? Structure versus strategy. 80% of pain, dysfunction comes from poor movement strategy. 80%. Only about 20% comes from structural problems. So the Pilates practitioner, the yoga practitioner, they're totally within their realm to be looking at helping to improve poor strategy, because it's all about improving the quality of the movement. So if we know what we want to achieve in the end, then we just back up to figure out what are those building blocks that person needs in order to achieve it. So 80%, and that's what I see all the time. I mean, most of the time when a patient comes in, they've just had poor movement strategy for a long period of time that finally set off the alarm bells that their body's saying, this really hurts. And so then you have to just unpeel the layers of the onion to figure out where's the final, what was the first thing that triggered all of this to go in that direction, 80% of the time. So most of the time I'm telling people to fix their posture, one thing at a time. You can't overwhelm people because you give them too many things to think about and they're not going to do any of it. But you start one building block at a time and all of a sudden they get it. When you're going to fix a movement pattern for somebody, the first 2 weeks you've given them a suggestion, they'll forget more than they remember. And they'll come back in and they'll be like, I'm sorry, I didn't really do a very good job. I thought about it later, but I just forgot about it. Then the second 2 weeks, then they'll remember more than they forget, but it still has to be conscious. Then the last 2 weeks, so that's a 6-week process, they end up feeling better. They don't even have to think about it as much. And when they do hurt, they remember, ooh, I'm obviously not doing something right, because now they've made a shift. So it's a 6-week process. If we think about how to master any sort of instrument, they say 10,000 hours. Well, it's been thrown out that it takes 10,000 repetitions to change a poor movement pattern. So it doesn't mean you tell somebody to do it 10,000 times tomorrow. But enough times of doing it in another way, all of a sudden the body learns the new way. So that process takes a period of time. So looking at Joseph Pilates' original statement of in 10 sessions you'll feel better, in 20 sessions you'll look better, in 30 sessions you'll have a whole new body. Well, in his process, when he did that, he had people wanting to come 3+ times a week. So if you look at that process, it's like, okay, 10 sessions, that's about a month, about 3 weeks or so. Okay, they've started to kind of, okay, they're getting it. Then you get another 3 weeks in there, and it's like, okay, yep, I'm really getting it. Then the last 3 weeks, everything's just moving in a whole different direction. So that's the difference if you look at where his sessions were. If you read any of his literature, he basically wanted people there committed. That was his big word, commit, commit, commit. So looking at the idea of improving poor movement strategy. So looking at our structural changes, so for Sandy, on the right side of the screen, on her right, that's where she has her fixed thoracic kyphosis for her thoracic spine. So she has this lift. You're going to have some people that come in that are stuck like this. So this is their body. They're always in this upper thoracic rounded position. We may not ever correct that. So we have to be aware that their arms will most likely never get higher than this. And that's okay. But how can we keep them as efficient and functional with that position? And what can we do to help get some length for their body? Then you have the scoliosis. We have the sides that are concave and the sides that are convex, realizing that there is effects for the shoulder even though the curvature is in the spine. And that goes back to that scapulothoracic joint. So we want to make sure that we're aware when somebody has some curvature, they have a side that's a little bit lower, they have a side that's a little bit higher, it's going to go along that entire spine. And we have the element that the spine is going to have a little bit of a rotation, not just a bend to it. So we can have some C's, some S's, some different things that way, but knowing that that does affect how one arm will function versus another. So just remembering that as you do movement with somebody, you may not be able to expect the same quality one arm to the other. So we want to optimize it, but what does that look like? What do I have to stop in that movement? We look at the concept of a forward head. So what I want everybody to do is just take your head and I want you to look down for me and feel what happens in your shoulder area when you look down. It generally wants to come with you. So when you look down, your body goes down. So I say that a lot to people that as they're kind of looking down in different places, if they're looking down, this is going with them. So it takes a lot of conscious effort to be able to look down without letting everything else follow. So we've all seen over the last 2 years the whole pictures that have come across on the internet, the text neck phenomenon, because as people are walking around, they're kind of going through here and going further forward. The idea is that this picture here doesn't take the full text neck, because that adds from the last picture looking down, but you put some weight to it, which has a huge impact on people because they don't realize how much their head actually weighs. So looking at it in alignment, and I've seen anywhere from 8 to 12 pounds as being the number. This actual particular picture shows 12 pounds. So we've got 12 pounds with our head lined up on our body. That's basically what it weighs. Then you move the line that your ear is in front of that line. So looking at that straight line that should go between right in the middle of your shoulder, now it weighs 32 pounds. I mean, that's quite a big difference, going from 12 to 32. And all of these structures in here have to figure out, how do I stop this bowling ball from falling off of the body? Because your head holds the majority of your senses, and your brain, in particular, does not want to fall off its body. So the rest of everything else will try to figure out, how do I stay here to make sure that this doesn't fall off? As much as it is damaging or putting other strain on other structures, it's all about saving that itself. You know, we're all in it for ourselves. Then the last one shows the whole head is in front. So we've seen people in that position, and that's 42 pounds. If this individual at the end then looks down, now it's 60 pounds. That's a lot of weight. That's more than most people's turkey on Thanksgiving Day, unless you have a really big family. So looking at how much extra weight that holds, and then what does it do to the shoulder? So looking at the first figure, the line goes straight through the side of the humerus. On the second one, the humerus is now in front, and on the third one, it's way in front. And then we also have that adjustment of what happens then into that thoracic spine and getting into that fixed kyphosis. Never mind the fact of what that person now has to do in order to see where they're going. So as that person is walking, if they're here, they end up staying in cervical extension. So if I was able to keep this posture and make my body go upright, this is what my head would look like all the time. So no work here, tons of work back here. But then everything else is trying to figure out, how do I need to be? So we have all of these things connected, and how that forward head then affects the shoulders, as well as the other way around. If somebody wants to sit in a slouch position, it's really hard to keep your head in good alignment there. You have to really, it feels very odd, so the head will just come forward. We have muscular imbalances that'll happen in people's bodies. You have some people that are very dominant in the front of their body. They just have very strong pectoral muscles, or maybe they just have other structures in the front that pull them forward. And so all of that makes them very much more that they want to use everything in the front of their body, and they don't use anything to the backside. So then those scapula can't move very well, because the muscles really don't know what they're supposed to be doing, and everything isn't really balanced. And in the body, sometimes when another muscle's in a more optimal alignment, the other ones will say, cool, I get to go on vacation. You got it, you go. And then it just waits. And then the other ones are kind of getting mad because they're working overtime, but the other ones are never in the right position to work, so everything just kind of stays status quo until somebody says, okay, now I've had it. I've put my foot down, I'm gonna tell you I hurt. And then all of a sudden, then the pain cycle starts. And then the person doesn't quite know how to get out of it because they didn't think they did anything wrong, because they didn't change anything. It's like, well, I've always sat that way, or I've always done that task that way. It never hurt before, but it hurt on October 4th. And so that's the element of just getting that realization of where do those things have to put together and what's important in that alignment. A lot of people come in and they just don't really know their body. They just don't have any awareness. They didn't know they had belly muscles. They just always thought they didn't exist in their body. They didn't know that their ribs needed to sit in a certain place in line with their pelvis. Or they just didn't know how their body should move. They just don't have that element of either awareness or understanding. And then you have to now kind of bring them back to kind of feeling different things and making them aware of their body. Some people are disconnected to their body for many other reasons, and they don't ever really want to reconnect. But knowing that pain comes up, it forces them, it's that alarm bell ringing and saying, hello, you need to listen because you're only given one. And the idea is, how can we take this one through life and make sure we can continue to function well? Some people will overcorrect their postural faults. So they walk around, they know that their head's been too far in front, so then they walk around like this. Or they're like, I'm going to go ahead and walk around and I'm going to hold my shoulders back. Got it? And we're all holding that chest on out. So they'll overcorrect the other way. So some people are just really good stewards and they want to do it. And then sometimes when you give them a cue and it's great for a period of time, then all of a sudden you're like, okay, you don't need to worry about that anymore. And they're like, what? well, what's going to happen if I don't think about that anymore? What's going to happen? And you realize it's like your body's now in the right place. Now we can think about something else. So the first time you take somebody into a Pilates session, or you take them into just being aware of their posture, and you talk about all these parts, and they're like, there's no way I can remember that. And they watch you move around the equipment or do something, you're like, how do you know? How do you know how to do that? And it's just like anything. You learn a task and you layer those awarenesses on top, and it seems daunting at first, but then you continue to layer it on and it'll come. And that's what I say to people that I love about Pilates, is that I can give you a cue at one time for this exercise, and that's what you need today. But in a month, I can give you a completely different cue, and the same exercise will feel completely different because now you're ready for it. You're ready for that next level. You weren't ready for it before because you can only concentrate on so many things at once. And then the biggest thing that creates different strategy is pain. Pain is 100% perceived in the brain. It happens from the brain. The brain is responsible for pain. Yes, we feel it other places, but the brain is the one that's responsible. So if we don't have that person be able to have that connection to their body, they're always going to just be focused on the pain. When people come in and they hurt, sometimes they introduce themselves as, hi, I have a cervical disc problem, my name happens to be. Hi, I have such and such, my name happens to be. So they identify with what they've been diagnosed or with where they hurt, because that's all in the front of them. And their movement reflects that. Because they might be like, yep, I'm not allowed to move my neck. Yep, oh, we're over here now. I mean, they'll start moving in ways, and it's just their own sense of what they thought needed to happen to keep them from hurting. And whether it was helpful or not, they'll continue that pattern until somehow, some way, some other movement helps them to get out of that, moving that direction. But pain is a big strategy that will change how people move. We have the idea of this poor glenohumeral rhythm. So when the ball of the shoulder and the shoulder blade move together, that's what that glenohumeral rhythm is. So it's the ball on the socket or the socket on the ball. You can have poor rhythm due to muscles not working very well. So we have more work, and I said that a little moment ago, but more work in the pectoral in the front of the body, less work in the back of the body. So we have this poor balance. We have decreased awareness, like somebody doesn't know that their shoulder should move in a certain way. They might have some non-contractile tissue around the shoulder, so ligaments, the labrum, other tissue that aren't like muscles that can retract and go ahead and stretch. Those might not allow that person to know even where their shoulder should be. They don't quite know where it's supposed to move in space. You have those individuals that end up coming in, they're very, very tight. Then you have other people that come in, they're very, very loose. They can just kind of move around like Gumby, and some people in the class are like, I want to move like that person. And that person just really has no idea where their body is in space because they're never given any feedback. And so that's even more challenging for that person to kind of know where their body should be. So people that move poor in their glenohumeral rhythm, they'll have a lot of scapular elevation. So when their arm is going up, so does their shoulder blade. So we've lost this nice little swing. It becomes an elevation. Or the movement of the shoulder blade's delayed. So they go to move their arm, and all of a sudden the shoulder blade stays behind, and then all of a sudden it starts to catch back up. Well, probably when we go to feel people in a moment, we might feel that on somebody. And I have a feeling we might, knowing that Sharon's arm, we might end up feeling a little bit on Sharon's. But knowing that there can be some times that the shoulder blade feels jerky, and that creates that element of knowing something is not working well. Or the scapular moves more in a downward rotation and depression, so it's coming in towards the spine and down towards the buttocks, that the body is overcorrecting something in that direction. So you can have this altered mechanics, and it's something that either they're doing with awareness because they're trying to correct something, or they're not. And those are two distinctive differences for that individual. If they're doing it consciously, much easier to fix. If they're doing it subconsciously, now we have to layer out to figure out why that's even happening in the first place. So now we're going to go ahead and do some self-practice. So go ahead and find a partner. So when you find your partner, go and stand on up, and one person is going to go ahead and stand behind. Okay, so whoever's going to be the touchy, just go ahead and stand with your hands down by your side. Now whoever's going to be the toucher, go ahead and take your hands, and I want you to place your hands on their triangle bones, the shoulder blades. So we're on two continents of Africa. So what I want you to do is go ahead and slide down and come to the lowest point of Africa, and that's going to be South Africa, so that bottom tip. That's going to be your inferior angle, so it's the lowest part. When you come on the inside part, so you can shift to one side or stay on both, when you come into that medial border, so it's the border closer to the spine, you're going to glide up and you're going all the way up to the northern part of Africa. So that northern part on the inside is your superior angle. What's important about that point, there's many muscles that attach from the neck to this area, as well as it's the attachment point for the supraspinatus, one of the rotator cuff muscles. So there's a big connection between your neck and your shoulder right here. This is also the spot that a lot of people will have a trigger point. A lot of times that's where there usually is a lot of muscle knot right in there, so you can give them a little bit of a massage, be nice to your partner. So then from here, as you're right at that superior angle, if you walk across, you're going to find a ridge, and that ridge is the spine, that spine of the scapula. So you're going to feel that, and above the ridge is your supraspinatus, and below it is your infraspinatus. So that's one of those things, places in the body that the name of the muscle ends up saying where it is, above or below that spine. Now when you come out to the side, so come up to the top at that supraspinatus and walk across, and you'll feel the acromion process. And when you feel that acromion process, if you keep walking forward, you'll bump into the clavicle. And when you bump into that clavicle, if you see where your finger is, just look at how they're standing. Is their humeral head right in the middle of that spot? And that spot is your AC joint, or the acromioclavicular joint. That's your bony alignment joint to tell you, is that humeral head lining up straight in the center, or is it a little bit forward, or is it a little bit back? How does their arm line up? If you want to see something different, have everybody that's being touched turn your hands to be palms facing forward and see, did that change anything for where they were lined up? And those that are standing, let your forearms relax, so keep that upper arm where it is. So knowing how that humerus lines up on that socket, right in that place. Okay? Now let's go ahead and change. So it's like, yeah, that's nice. Okay, so we're going to go ahead and go down to that individual shoulder blade, so down at the very bottom. So we're going to find those points at the very bottom. That's going to be our South Africa part, that inferior angle. Now we're going to walk up the inside part of the shoulder blade, so along the spine area. So that's that medial border, and you come up to the top and we come to that superior angle of the scapula. And at that point you might feel a little bit of those, few little knots or some tension right in that area. Then if you walk more out to the outer part of the shoulder, you should feel that spine of the scapula. So you're going to feel a nice little ridge along the scapula, and that's going to be the spine. And if you continue to follow along to the outside, you're going to go ahead and follow along to that acromial process, still on the shoulder blade. All of this are parts of the shoulder blade of that triangle bone. And once you're there, then you should bump into the collarbone. And if you're not sure that you're on that clavicle, then you can kind of come around to the front and kind of follow along, and you can kind of feel where that end of the clavicle is, and then you come right off of it, and then that's going to be your AC joint.
So the most bony protrusion there is the end of the collarbone still. And
on most people, yes, but not, and then some are going to be way more prominent than others.
Okay.
Yours is a very good example.
Okay.
So having that spot on that, so you'll have some people that have injured that joint, and so they'll be even more elevated from one to the other. So then if you look at where that AC joint is and you look from side to side, where does their humeral head lie in relation to your finger? Now if that person is standing, go ahead, as the person standing that's being touched, turn your hands palms forward. With those palms forward, feel if does that change anything, and that looks. And then everybody that's standing, just relax your forearms. And so it helps to hold those arms in a proper place. Now, Emily, do you mind if I use you as a demonstration for something? So I want everybody to go ahead and come around and see Miss Emily's back, and I want you to see the difference of somebody that has a much flatter thoracic spine. So you can really see her shoulder blades very prominent off her trunk. So she no longer has the actual kyphosis in her thoracic spine, it's flattened. And some people it's just their bony structure. So what that does is it totally changes how the muscular structure of the shoulder blades can lie on her trunk, because now it's not rounded. Your shoulder blade is actually a little bit rounded. There's a little roundness to it. So that's why her shoulder blades look like they're popping out of her back, is because they're not sitting on anything rounded anymore. They got to figure out how to hold themselves on this structure. Now, if she was able to round a lot, so you're just going to try to round right through in here. If she was able to round a lot, you can see how now her shoulder blades aren't quite the same, but now she's had to accommodate in other parts of her body to do that. But you can see how they feel like now they sit on her body in a little different way. Thank you. So, Miss Sharon, if you could come on up for me. It's this shoulder that's the injured one, yes? So I'm going to have you all watch. Do you mind taking off your shirt so that they can see your shoulder blade? Thank you. Okay, so what I want you all to do, oh, you good? Yeah, they could stay on. I want you to see, so I'm going to just take my hands on her inferior angle of her scapula. Now I want you to just reach your arms where you feel best to go. So don't go super high elevation that you feel uncomfortable. I want you to go up. And then bring them on down. So what I want you to do here, we'll just go ahead and do that abduction range, so out to the side, so that way you don't feel like you have to go through me. So pause for 1 second, come back down. I'm going to make you move a little slower. So I'm on the inferior angle, so we already know there's a difference, because I can tell you right now my hands don't feel the same height. I'm not looking at it, right? So now we have just a difference of where the shoulder blades are lying on her back. Now I want you to move out just an inch right there. Now my hand should not have moved, right? Because we're only at about that 30-degree mark. Now from here on out, you should see my fingers move as her arms move. Now go ahead and just try to raise where you feel comfortable to go. And look at the difference of where my right hand, her left shoulder compared to her right shoulder is. Yeah, I'm on the same point that I was on. And then gently go ahead and bring them back on down. It's actually a little bit better than what it was. So do you see how her left arm moved way more than her right? And that's the painful side for her. So looking at the quality of the movement, there was a rush that everything moved together. So this is actually better than what it had been earlier this year when I had seen Miss Sharon. So going from letting that element of sometimes the shoulder blade will be delayed, other times it'll rush ahead. So now they're moving as a unit. And if they move as a unit, now we've changed how that glenoid fossa is facing, and the shoulder has to catch up. So now what I want you to watch is watch what happens. I'm going to keep my fingers in the same place. I want you to watch what happens to the top part here of her shoulder blades as she's moving her arm. Look at the difference in the neck area from her left to her right. Right? So you can see that the rush ended up being in an elevation. Yeah? And then go ahead and bring them on down. So there's a weakness on on the left side, so now it's looking at the quality, so now we no longer have that good glide of the humeral head in the glenoid. Now we have them trying to move together as a unit. So then it's like, okay, well, why would these things happen? Lots of other injuries that might happen. There can be surgeries that'll happen on the front side of the body that'll line things up, but what's happening is that this shoulder blade is not moving as well as the other. So what I want you to do is both partner up again, and I want you to take your hands on your partner's, thank you so much, on your partner's shoulder blade, and as their shoulder blade is moving, I want you to just take your hands and follow along. Does it feel the same, or does it feel different? So this is what we're looking for. We're looking for this nice little wing open, wing closed sort of movement, and they can move this way, out to the side, or they can move to the front. I can tell you it's a little easier to feel the first time feeling it when they go out to the side. Okay, so just give yourself some range so you don't hit somebody. And don't ask them until you felt a few times, but then ask which arm is dominant. After you felt it, after you feel, if you feel any asymmetries, let them move and then ask them which side they might be dominant on. And then once you've got it on one, you can switch to the other partner.
It feels, to me, I don't notice any super significant difference, but it does almost feel like this one just feels like more like it's like it just feels a little thicker, slower, like there's more resistance.
Yeah,
like the best.
I can feel that.
Okay, yeah.
Yeah.
So sometimes if you actually take your hands and do this, just initially, and then go ahead and then you can feel what you can go along with it, and then just kind of going that way.
There's definitely some added, there's some assistance there.
You can do the same, because it's going to move this. The shoulder blades will move the same, so it's just the elevation of the body. Yep. So did anybody feel anybody's shoulder blade kind of move, kind of like jerky when they went up higher? Some cracking, yeah. So everything. So sometimes what'll happen is one side will move and it'll be kind of moving just fine and slow, and then the other side will it kind of feels like it's ratcheting a little bit. So, and that's again an influence of what the muscle balance might be on that side. So knowing that the goal is that it's smooth. It's this nice little out then in, it's nice smooth movement is what we want to see. And if there's one that's off a little bit, again, we're not looking to necessarily say why it's off. Now the physical therapist, yes, I would want you to try to figure out why it's off. But as a movement practitioner, it's not really as big of a deal to figure out why is this not working that way. It's more, okay, it's not working well, so now let's figure out what sort of things do we need to do to make that move better. So now we're going to move into where we're going to go through different positions of the body, different exercises, looking both mat and reformer, and looking at, well, what's the advantage, disadvantage. So the idea of the supine position, so that means laying on your back. The advantage of that is that that person lying on their back has a lot of tactile input to their scapula. So that shoulder blade is resting on a surface and they can feel it. It also can be a disadvantage, because now all of a sudden there's locking potentially of the movement, because now it might feel like it's blocked and can't move along the way. But it's a lot of awareness of knowing, oh, I do have a shoulder blade. It is on my body. That's what I feel. So just kind of giving that awareness for that individual. So we look at movement in the sagittal plane. Sagittal means flexion extension. So things sag to the front, they sag to the back. So think sagittal sags. Frontal, also called coronal, and that's things out away from the body. So this is ab and adduction. Transverse is twist, any rotation. So in the shoulder, that's our internal and external rotation happens in the transverse plane. So we can have any of these movements in this supine position. So the first exercise is a simple exercise called arm arcs. So I have one page that's showing it correctly and having the body lined up and having everything in the right position. The second page, if you flip, you're going to show, you're going to look at correct and incorrect. And the biggest thing in the incorrect that you're going to see is the position of my back. So you add something into it, somebody else is going to move in a way that isn't going to allow that good glide of the scapula, because now we've changed the structure. So when we think about how the trunk should be lined up, the image that I like the best is to think of the body as 3 rings. You've got your pelvis as one, your rib cage as another, and your shoulders as the third. So they don't stack up like the nice rainbow Fisher-Price toy. So our biggest ring, the bottom ring, is up at the top. Our littlest ring is in the middle, and our medium ring is right here. But they all stack on top of one another, and if at any moment any of those rings get off from one to the other, then all of a sudden everything else that needs to move off of those rings has to do a change. So if we change that rib cage, so what you can see here is that rib cage ring is way in front of both the shoulder and the pelvis ring. So in order for that to happen, then now all of a sudden I'm in extension of my thoracic spine, so now my scapula aren't really connected as well to that thoracic spine, and they're trying to figure out how I'm supposed to move. Now my arm still went over my head, but look at the difference of movement. I didn't necessarily stop my movement just for the picture. That's where my body didn't want it to go anymore, because something else was telling me don't go anymore. Plus for a picture you got to hold it for a period of time to make it look bad. So the idea of an arm arc really truly is taking those arms over that head and then coming back on down. It seems so simple, but a lot of people just don't know how to move their arm separate from their trunk. Everything has to go along for the ride. I mean, everything comes up, everything moves, and this is with or without a weight. So just being able to move. So let's take 3 people and just have you guys lie down onto these mats right up here. Watch out that these sticks are stuck in, so try not to trip. And then have your heads at this end of the mats here. So just go and lie down onto your backs, knees bent, feet flat on the surface. So when we lie down, we want to make sure those feet are that fist width apart. That allows your thighs to be that fist width apart. So we have that good alignment of the thigh bone, shin bone, second toe, which we'll talk a little bit more about in just a little while. Then bring your hands to your pubic bone. And I want you to make sure that those hands are parallel to the ceiling. And that's going to get our pelvis in as level of a position for our spine as it needs to be. Now let your arms be by your side and turn your hands palms up to the ceiling. And I want you to scan up to your rib cage and make sure that your ribs are reaching as close to the mat as they can without changing anything in the pelvis. And keeping those hands palms up, it should allow those shoulders to feel like they're resting where they need to be towards the mat. Now from the elbows down, just turn those hands so the palms face in towards your body, so thumbs are up towards the ceiling. Now I want you to inhale to float those arms up to the ceiling. Exhale to let those arms continue to float overhead as far as you can go, that everything stays exactly the same that it is here. Inhale to let those arms come back to the ceiling, to exhale to press the arms back on down. So as you start the movement to go up, imagine you have puppet strings attached to your arms, and they're floating up towards the ceiling, and then as they continue overhead, you're pressing them down through some water, so you press a little bit through some resistance. As they come back towards the ceiling, they're floating back up, and then as they go back down to your side, press down through that water again to feel that connection. So keep that image in mind and keep the movement going at your pace. And as they keep the movement going, I want them to be thinking of that resistance of the water because it allows them to engage the muscles through the back side of the arm into that armpit, which then funnels the connection into the trunk. So now I've connected them in without telling them where I wanted them to feel it. If I told them, I want you to feel it in the back side of your armpit and I want you to press as hard as you can, they're going to over muscle it because now they've already put their focus on that specific muscle. And I want it to be this nice fluid movement. So getting them that sense of where that body is moving in space and be able to do the movement. Now as you all keep going here, I want you to go ahead and change one element of your trunk. Pelvis to rock forward or back, so either come into a posterior tilt to smush your lower back or an anterior tilt, whatever feels better for your spine right now, and do the movement and feel the difference that happens in the quality of the movement and what changes through your body. Micheline, how does that feel different?
Less range and like my shoulder, but my shoulders are off the table.
Can't keep the alignment. Right. Emily, what do you feel?
I feel when I come down that I roll forward a little bit, and I think I also get a little bit of a arch higher up. When I tuck down, I actually get
even more on the higher. And Brady, you arched, right? What did you feel different?
That I couldn't go as
far. So changing just one, I mean, that was just one element. Yes, it translates up the entire spine, but then it changed their arm quality. So if we don't set the person up correctly for a simple exercise like arm arcs, their success at doing much more complex exercises gets much more challenging. So that awareness of how do I line myself up? So those pre-Pilates or those basics are such good foundations and fundamentals for people to then be able to do something more challenging to be able to go through the next thing. So now we're going to go on to the reformers. So 3 people onto the reformers. So we're going to take the same exercise. So let's go ahead and do just one red spring. So nothing too challenging. We're going to lie down onto our backs and bring our hands into the little loops. So we're going just in this supine arm series on the reformer. So what you can see, I've got a similar sort of change in my posture on the incorrect on the picture. So what's going to happen is I want them to go ahead and bring those hands into those little loops. They'll press out a little bit once they get their hands up towards the ceiling. So their ribs are down, their pubic bone is parallel to the ceiling. Now they're going to march one leg up at a time into that tabletop position. Now those legs are going to magnet together. Either they're actually going to stay together or they can have 2 lines, but they need to stay connected. Now they're going to do the same push. They're going to exhale to bring their arms down by their side and then inhale to let the arms come back up. The difference here is they're connected to the machine with their body. They're now moving, so now we've upped the ante a little bit because we're on a movable surface. They're still lying down. The range is more limited versus being on the floor. We can really get those arms overhead. But now they actually get to find their belly muscles. So a lot of times you put people in this position and they're unaware of how to hold their legs up in space. So safely for all of you guys, allow your backs to arch. So allow those knees to reach a little bit away and feel the difference in your body as you do that. So potentially now it's much harder on their arms and they potentially feel it in their lower back. So we want to make sure that we keep that person lined up well. So then this is that foundation for the 100. If they can't do this well with load, they have no business curling up. So we have to know that because curling up, we change that angle of that scapula because we've changed the thoracic spine into a kyphosis, into that curve, a long flex position. But when they need to make sure they can do this. Now on the reformer, then we can be fancier and they can take their arms out towards a letter T. They can draw circles. They can do one arm up, one arm out to the side. So any sort of different changes of movement that they want to do, but we're within that 90-degree range. That it's a push with the little finger side of their hand more than the index finger side. So what I want you all to do is just do up and down and think of pushing from your index finger for a few and then push from your little finger for a few. If they push through that little finger area, now all of a sudden it's that back line of the body through the triceps into the outer part of the shoulder blade. All of a sudden now we've lined up into the serratus anterior muscle, which is continuous with your external oblique abdominals. So now I've given them a way to connect to their trunk without telling them how to engage their abdominals, just by telling them where to push from. Just that little difference of that finger. So just again, a simple building block that you change where you're putting that focus for that person, and all of a sudden it's a completely different exercise. So if you do this exercise with somebody and they're like, you know, this really hurts my back. Now let's say they're not strong enough to have their legs up. You can do the arm work with their feet on the bar and they'll just go back and forth. But if you want their feet up, because you know they can, but they just can't seem to get that, then it really comes down to, well, what's going on with their middle part of their body? But what's happening with all of those components and what's the missing component? So knowing that supine arm series is directly related to that arm arc, now we've upped the ante by putting them on a movable surface and changing where that pressure is. Any questions on those? Now we go to the prone position, and prone means lying on your belly. So those that aren't familiar with that terminology, that means lying on the belly. So this exercise that I've chosen for the mat version is called scarecrow, and scarecrow has several different elements to it, and it's very important that these elements go in the correct order. If they're not in the correct order, then it's going to mess up the entire exercise sequence. So the idea of scarecrow being on the stomach, we're adding a little bit of thoracic extension, but we're also adding shoulder external rotation. So there's this sense of swimming up and away. So if I want 3 people on the mats right up front here, please. And then when you're on your stomach here, I want your heads this direction. So heads facing towards the group. And then let your hands rest on your sticks. And your elbows can rest towards the ground if they feel okay to be so. So when we line somebody up on their stomach, we want to make sure that they're thinking of that same alignment through their body that we talked about lying on their back. So we want to think about scanning that trunk. Where's that pubic bone? If the pubic bone is pointing towards their feet, they're going to be a little bit too arched than their lower back. So we want them to think that their pubic bone is zipping up parallel towards their breastbone or reaching towards their belly button. So getting that pubic bone in that right place, now we've lined up that pelvis and we put that in the right position. Now as they're lying there, their rib cage should be lifted a little bit up, that lower rib cage a little bit up off the surface of the mat. If they let it stay down, then they're potentially going to feel a pinch in that upper part of that lower back area. So they're drawing that in. So we think lower part of the breastbone and the pubic bone are gently trying to pull in towards one another. Now at the same time, there's an imaginary string from their breastbone and trying to pull them out away from their feet. So we have this opposition happening through that entire middle. Their nose is hovering off the mat, so they're looking down at the mat, but their nose is hovering. As far as the neck position is concerned, they should be able to hold an imaginary peach underneath their chin to their very top of that breastbone area. If at any moment that chin goes away, we've lost that peach and we've put more load into the neck. So what they're going to do first is they're going to go into shoulder external rotation first. So the hand, wrist, and forearm will lift up. Elbows can stay down on the ground. Now, once that hand, wrist, and forearm comes up, their elbows are allowed to lift only at the height of the hands. So if at any moment their elbows get higher, we've now gone into internal rotation of the shoulder, and now we've changed the quality of that shoulder alignment. So that elbow lifts up to the hands. Now they're going to lift their chest a little bit up off the surface. Then they're going to lower their chest, lower their elbows, lower their hands. So inhale to lift the hand, wrist, elbow, wrist, then lift the elbow, lift the chest, lower the chest, lower the elbows, lower the hands. Hand and wrist and forearm, then the elbows. Good. Then the chest, lower the chest, lower the elbows, lower the hands. So there's a lot of work going on in the very back part of the shoulder, not so much the shoulder blade. So what I don't want to see is that as they're lifting themselves up, these shoulder blades draw closer towards one another. If they do, they will block their movement. So I want you all to try that. So what I want you to do right now, I want you to pull your shoulder blades towards one another as much as you possibly can. Okay, let those arms come up a little bit too, and then now try to lift your chest off the surface. They're like, okay, where do I? So now they're trying to figure out, and go ahead and relax, where's the movement supposed to come from? No longer can it come up from their upper thoracic spine. It's got to now come from their lower thoracic or their lumbar, which now I've totally blocked a complete area of movement that for most people they need. Most people need upper thoracic extension, not necessarily more lumbar. So if we pull those shoulder blades back, we've locked it in, it's not going to move, it's going to come from someplace else. So we want to make sure that we're getting it from the right place. You all can come back into prayer stretch. So did you all feel, Natalie, did you feel that in the back part here? So the idea of the arm, and it's this kind of goalpost position, the idea is that it's kind of coming through this nice movement here, and you can see Daniel's oov work from there, right? So you can see this nice little rotation movement. That's basically what's happening with Scarecrow. It's this nice movement in this direction that the body is going without letting anything collapse below or too much movement above. So this nice reaching of the body as if we're opening up. There's a lot of Fletcher towel work that happens in this kind of position, in this lengthened position. So just being able to take that openness on this stomach position and let that person move against gravity from there. Do it super retracted. So if I come like this and super retracted, so I'm gonna turn for the camera. So you come around over here. So if I super retract my shoulder blades and then I try to lift, see where my movement has to come from? It's coming right in here. Versus if I stay in the right position, see where my movement comes from? I even get taller, right? Versus if I retract to go back, I actually get shorter. So I've totally lost my axial elongation and I've compressed more, which puts more strain, and then it feels pinchier. So the person's like, yeah, it feels pinchy in my back. Then you automatically know they lost their elongation. Okay. Yeah, yeah. So a lot of people, when they have weakness in the back part of their shoulder, I'm not talking shoulder blade, I'm talking shoulder. If they have weakness there, they'll substitute it for the retractors of the shoulders. They'll end up doing it from there, okay? Now, somebody that, like Kathy, who's here several months into her pregnancy, she can do this exercise against a wall. So you can change just the orientation. So instead of having her lay on her belly, she's going to do it more in a standing position. You just use the wall, and they're not in trouble. A lot of times you take somebody and they have to face the wall. They're not in trouble, but they have to do stick them up position. But being able to get that same sense of work, which is great for somebody that's further in advancing stage of pregnancy, because it basically, pregnancy there wants you to always do this. So it's like, how can I open myself up and not have everything come down? So being able to get that openness is huge. So those that have never done Scarecrow before, if you want to go ahead and get down onto the floor. Now if you want a mat, we've got some other mats here. If you want to take one of the mats up front, take one of the mat tables, either one. So just to kind of make sure, so hands are out to the side, hands can be onto the stick, elbows can kind of rest down towards the ground. We're going to let that hand, wrist, so your nose is hovering. We've got that good connection of that pubic bone, breastbone kind of connection there. Kathy, just use the door. Yep, perfect. As long as it's not too chilly to have your hands on the door. Nobody should be coming in. Oh, sorry, you got the handle. So now from here, you're going to go ahead and take that hand, wrist, and forearm and lift that hand, wrist, forearm off, keeping your elbows pointing down. Now, as you lift those elbows a little bit further off, keep those hands going back behind you. So keeping that rotation. Then gently lift your chest a little bit higher. Then gently bring your chest down, lower the elbows, then lower the hands. So hand, wrist, and forearm first. Then as you lift that elbow, still make those hands stay higher. So I want you to keep thinking of that. Yep. Then go ahead and lift that chest up. Keep those arms going back for me, Alexa. There you go. And then gently lower the chest, lower the elbows, and lower the hands. So that element of where that's happening, that nice little sweep this direction is going to be the important part of the movement from there. Okay? So on the reformers, if you all could put the long boxes on for me, please. So we're going to take this onto the reformer, and we'll go ahead and put just a red spring just to make it easy as far as a push. And we're going to go ahead and do this long box prone shoulder flexion. So this is probably the interesting part. We've reoriented the body a little bit, and then now it's in this prone position. And remember that shoulder flexion is this movement here. And I think a lot of times when people are on their stomachs, they start thinking, well, I'm actually extending the shoulder. So just medical terminology, if we actually are taking those arms over our head, that's still flexion. Extension is in this plane of the body. It's moving here. This is extension. This is still flexion. So this is why this exercise is called prone shoulder flexion, because we're moving in that range. So as they're lying on their stomach, we've got a couple options to do the lineup for the legs. If I'm not concerned with what's going on in the lower back, I'll still have that individual keep those legs parallel on the box. And Julianne, I'm just going to kind of wiggle you so you're straighter into your box. The other option, if I'm concerned that their pelvis isn't quite as stable, I'll have them open their legs and rotate their legs out a little bit to kind of keep that pelvis a little bit more locked in. So either way, you guys can be in whichever position. Now what I want them to do with their upper body is I want them to stay as parallel towards the ground as they can. And then all they're going to do is they're going to push their arms nice and straight. And then gently bend the arms. Now what you're going to be able to do here is, this is a great position to take your hands on somebody's shoulder blade. So you all can come on up, they don't mind. Go ahead and press those arms nice and straight. You can feel what happens in that shoulder blade glide as they go. So as they come back and forth, you can follow along and just to see, even with a load, how do their shoulder blades move of one versus the other. So if you want to come over and feel Julianne, her left is moving differently than her right. You can end up, for somebody loading this exercise heavier, it's a little bit more arm strength work. And then if you make it lighter, it's more about that range of motion. So having somebody that might be a little limited in that range, you can start getting them to get that range of motion. So for instance, that person can't quite lie down on their stomach with their arms straight out in front of them. They just can't quite get there. Their arms always have to stay bent, or they're out a little bit wider. How can I get them a little bit more range? This is a great position to kind of work on increasing that range. And if this bar setting is too high for somebody, we can actually put the bar down a notch, and it can actually be a step up. So I can lower the bar and then allow them to get through the movement from there. And I like the fact that when the arms are bending, that they're bending slightly out to the side, slightly towards the floor versus wide. If we're here, we're generally going to allow that person to want to round. So this position tends to cause this. If those elbows are a little bit down, a little bit out, you end up being able to stay in that nice body alignment range here. The wider they go, the more something else is going to change up above, which is going to cause other problems through the quality of the movement. So placing the hands on the frame, so even lower. So you can change for somebody that has, and especially for somebody who has a very fixed kyphosis that you know you're not going to change, but you want to give them that sense of gravity differently on their body, just lower their hands. I mean, that's as low as we can go on this piece of equipment. So yeah. And then you can start working on that range, and especially on rehab purposes, for somebody that is coming in with some shoulder issues that we want to start working on the sense that their body is long, we can start lower with those arms because that's the range that they have. Okay, so you can see in my second picture, I tried to change where my head was lined up and my body was, and I think it kind of looks like I'm diving into the water, but not really the exercise we want to see on the reformer that way. Okay, so now we take it to more of a side lying position. So the biggest challenge in side lying is people don't tend to get there. It's an unfamiliar position unless they're going to take a nap. So to exercise there, sometimes people have other things going along in their body trying to figure out, well, how does this feel on my hip and another part? But knowing that when we're lying on the side, we're at a different orientation to gravity. So the body has to work differently, and we have to have that awareness of that movement in a different way. So we're working mainly in this frontal or coronal plane, and we have the idea of stabilization. So how do we move the body around a fixed arm? And that's what this side lift does. So most of the time what we've done up to this point is we've moved the ball in the socket. Now we're moving the socket around the ball. So a different awareness for the body. So the trunk is moving around a fixed arm. And having that arm fixed, now we can start with a much regressed version. So I have my knees bent and on my forearm, and then I show a little progression of what that outer arm and leg are doing. And these are all these stepping stones for the big finale mat exercise called twist that we're on our hand that we want to be able to go through and do. But if the person doesn't have the building blocks yet, then it makes that exercise much more challenging. Okay, so if I want 3 people that want to go ahead and try side lift. So let's have everybody on their left forearm. So we'll face towards the windows. So we'll make sure we line up, and this is again that idea of setup. How do we set somebody up? So when they line up, I want to see their humerus vertical. So their arm bone is vertical. Then I want to see that they have a good horizontal with the mat. So now we're making a right angle under their body. So their trunk is a diagonal line, and that's what I want to see before they even lift, that their trunk is in this diagonal line. Versus I want all of you all to slouch a little bit and let your rib cage come down. So this is kind of like I'm just relaxing. That's really not the start of the exercise. We need to make sure that they get all the way to this good diagonal line first. Now with their legs stacked, their top hand can either be on their body or on their belly. If somebody really needs some extra assistance, the hand can come in front. But I want them to keep their hand on their body, and now they're going to go ahead and push through that arm and their knees and then float the hips up. And then down they'll come. And then they just float on up, and then down. Ultimately, for a plank position, 30 seconds is all you really need to hold it. That's going to be your ideal hold, 30 seconds. Anything more than that has no added benefit, and you're actually potentially going to create some more fatigue in other areas that will then end up compromising and put more joint compression. So 30 seconds is what we want to get to. Now, if the person can hold 30 seconds very easily in this position, then you start lengthening out limbs. You start taking things away. So you start to make it more challenging as you go along. So the most challenging would be that the bottom leg is straight, the foot is flexed, so we're on that outer edge of the foot. They're able to lift up, and their top arm and leg are no longer resting on their body. So that's the star position. That's the ultimate of this whole side lift. And that's where we would want that person to be able to get to, but knowing we start with those knees bent, and then you slowly lengthen out the levers from there. But 30 seconds, that's where the plank, and I know that there's all things out there of people wanting to hold planks for 5 minutes and working in from there, but 30 seconds, and then we move on to the next thing. And anything that we're doing in the Pilates, thank you ladies, anything we're doing in the Pilates repertoire, we always end up, as we're adding things in, it's all about building from one thing to the other. Joseph Pilates, in his Return to Life book, in his 34 mat exercises, it was all about building from one thing to the next, and you're using similar muscles in a different way, and you're changing the orientation of gravity. So there's a lot of genius in his work and why that flow works in that way, and it's really about putting those building blocks together. And just that knowing that we have clients that come into the studio, we can't always take them and throw them right into that work because they're just not ready for it. Their body just doesn't know how it's supposed to line up. And then all of a sudden you get them moving, and then they start to feel that movement, and they've got those building blocks, and now they can do the grand finale from in there. So now let's have 3 people on the reformers. Let's do 1 red spring. So the exercise Cleopatra. Cleopatra is a Corolla Trier exercise, and Corolla Trier was one of the elders that actually worked directly with Joseph Pilates. She was the one that opened up a studio when he was still living. With his blessing, he wanted her to. So he was only a few blocks away. That in New York City terminology could be like you were miles away, but for whatever reason, that's just how they function there. But she had a lot of good relationships with the medical community. And she probably created much more relationships with the medical community than Joe himself did. So Carola had a lot of things to be able to contribute to the work that she learned directly from Mr. Pilates. And Kathy Grant and Lolita San Miguel actually trained with Carola first. And they wanted to know more. And they didn't even know he was still alive until she said, well, you just need to go to Joseph Pilates. You need to go to his gym. And they didn't know, and then they were able to go through and get their certifications directly from him. But knowing that this individual had a lot to contribute, so her proteges, Deborah Lesson, Jillian Hessel, are going to be the two people that carry a little bit more of her flame, Deborah Lesson more so, going forward from there. So this Cleopatra exercise, and the big focus of it really wasn't for the shoulder stability that I'm kind of focusing on it here. It was more for people with scoliosis. So somebody that had a curvature of their spine, they would only do this on one side to open up their concave side. So the lineup is the hand is a little bit in front of the shoulder. That outside hand is going to be onto the reformer carriage. Both knees, both shins are going to be against the shoulder blocks. So you're a little bit more in this side sitting position. So then they're going to press on out and lie down on their imaginary couch. So this is like they're being carried around, Cleopatra being carried on her couch. Now they're going to take both hands are on the carriage. You're going to keep them flat, that one flat on the carriage, and you're going to push them towards one another. As you do so, bend your body away. Don't turn your head yet. Bend away, bend away, bend away. Once you feel like you've bent as much as you can, then turn and look away from your hand on the foot bar. So you inhale to go ahead and lower on down, looking straight ahead. Exhale to press, left hand and right hand press towards one another to side bend the body away so that left arm stays nice and long, and then gently turn to the right, looking away. One more time, inhale as we stretch it on out. Exhale, they're pressing their hands so they get that length on both sides of the body, lifting the body up taller, 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 to then turn to the right. So it requires a lot of bend in the spine to get the movement, and so if the carriage doesn't come all the way in, that's okay. But what we're looking for is that sense that the body is moving around a fixed arm, and that's what's happening again. This time, instead of just coming up, we're actually side bending the body away. So go ahead and lie down onto your imaginary couch, and as we come on in, press those hands and bend away, away, away. Keep that left hand on the carriage, and then turn your head away. So keep this arm straight as you come in. So keep pushing. Yes. And then keep that elbow straight and go back out again. So go ahead and press it on out. So your arm is like a kickstand for a bicycle. We're moving that trunk around that kickstand to be able to come up and side bend. Thank you, Alexa. Good. And one more time. Inhale to go ahead and come on out. And then exhale to get that nice connection to really lift the body higher, 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 to bend, 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 and then finally turn and look away. Good. And undo. Anybody else want to try this? Yeah.
Somebody has to join.
Yep, good. Natalie is. Lynn's coming on over. Okay, good. So we're all going to face towards the cubbies. So you're going to take that bottom knee, and that's what's important. Get that bottom shin all the way against. So Natalie, up there you go. Yep, perfect. And then you're going to take that outside hand, and you're going to put it on your carriage. Good. Right hand is on the foot bar. Now make sure that right hand is a little bit in front of your shoulder. It'll just give you a better kickstand. Now you're going to go ahead and push on out, and as you push on out, looking straight ahead, this is where you can kind of really connect and look straight to the cubbies for me, Miss Natalie. Good, you can really connect those two hands towards one another. So your right hand is pushing down now. As your left hand feels like it's pushing towards the right, you start bending your body over, over, over. Stay as long as you can keep that arm long, and then turn and look away from your hand. And then you inhale to look forward and stretch on out. Good, you exhale to go ahead and press and lift the body up, 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 and over, and then finally look away. You feel that difference? Mm-hmm. and then go ahead and reach away. So what I was coming over here with Lynn was that as she was coming up, her humerus was coming forward in that socket. So she was actually internally rotating. So what I want her to think about is pressing more through that little finger side of her hand so we engage a little bit more through the back side of the shoulder for her to keep that alignment.
It's hard.
It is hard. And then go ahead and press it on out. One more time. And then getting that sense of connection of both hands, reaching and pulling, lifting through the body, bending, bending, lifting, and finally looking away. And then go ahead and turn around to the other side, just so that way you feel like you didn't just bend one way.
Would it make sense to lower her bars?
Yes, you can lower it. Now the difference with lowering it is now she's going to be a little bit further away, so it's going to feel a little longer this way. So I could put a foam roller or something by her legs to scoot her forward on the carriage. Yep. So now I need this leg to come all the way against. Yep. So slide there. So you're actually they're in this kind of side sit position. They're in a little bit more on that side of the body. So that way as they're coming on up, they're able to get that good lift coming on through. And keep a sense, if you start to lose contact with that right hand, you came in too far. And that's what a lot of people, they want to come in, they're like, but I think I can bend more. But what happens in that bend is they've lost the length of the bend, and now they've added some compression. So something has changed, or they've shifted. There's been a little side glide versus a nice long arc. So you only come in as long as you can keep that contact. And some people will complain and say their arms aren't long enough to their body. We're all up proportion exactly how we were supposed to be, and it'll be fine. And you can see how this is a little different orientation for the body moving around that arm bone. Just a completely different challenge. Okay? Yeah. Thank you. Okay, so what I'm showing in that second picture is really a lot of that collapse of my body and the fact that the shoulders way forward. So I try to do as many wrong things as I could at once. So that way you can see the difference of where the body is. So now we move on to the hands and knees position, or just the idea of being on weight bearing onto those arms. So this being our kind of going back to our nice little side lift position. We've got the same sort of thing of weight bearing onto those hands. But take into that quadruped position, that hands and knees position that we've all been in before at some point in our lives, because we've all crawled at some point, even if it was for a very short period of time. But looking at how we're lined up makes a big difference. And a lot of times people end up getting in this hands and knees position and they're really unaware of where their body is in space because they have no more tactile input. It's just their hands on the ground, but they don't know where their back is, they don't know where their front's supposed to be, they're just completely off. So we can use dowels and other things to get them to line up their spine, but if we get them to know where their arms should be, it makes a big difference. So let's have 3 people onto the mats here. Now if you have wrist discomfort, go ahead and make sure that your hands are to the front edge of the mat. So we'll keep our heads pointing this direction. So the hands are going to be directly below the shoulders. Knees are directly below the hips. What I want everybody to think about whenever you put weight on your hands is that those elbow creases should be looking at one another. And then the second rule is you want to think of your hands pulling slightly toward your body and slightly away from one another. So it's like it's creating a letter L. They're not actually moving on the mat, but now all of a sudden by drawing them down and out, we've engaged the muscles in the back side of the shoulder without me telling them engage in the muscles in the back side of their shoulder. Because if I said that term, they'd be like, I don't know what you want me to do. I don't know how to do that. Or they potentially would have drawn their shoulder blades too far together. So this way, they've been able to keep the width across the front of the body. So we've potentially heard cues given to ourselves to really reach those collarbones to either side, reach through either shoulder. And sometimes people are like, I'm not sure I get it. I don't know how to move there. But just giving them a little bit of movement through their arms, it does that for them. And then from here on out, we're just thinking of that length from the head to the tail, and then you can now add any fancy movement choreography that you want. So rounding the spine, allowing it to lower down into extension. We can do raising arms, raising legs. So anything goes from this foundation. So setting the foundation makes a big difference from there. Now I want everybody just to go ahead and relax your arms a little bit for me so you're still on them, and relax them and just allow yourself to feel like you're relaxed. Now the difference you should see that happen in all of their bodies is all of their bodies sunk down towards the ground. So now there's no longer a connection here. It's as if those shoulder blades are doing the best they can to make sure this body doesn't fall down flat on its face. Again, the brain will protect itself, which means it's in the head and it will not let you smash your face in all intents and purposes. Okay? So knowing that if they just go ahead and now take those elbows to point towards one another and they all of a sudden engage those arms down and away, everything now lines up. Okay? Thank you very much. Now we'll go ahead and do one blue spring on the reformer, and we're going to take this exercise to a reverse abdominals exercise. So reverse abdominals, we're facing the other way. So they're going to line themselves up so their knees are a fist width away from the shoulder blocks, and their hands are going to be on the frame of the reformer. Now we can make this a leg exercise movement, or we can make this an arm exercise movement. But if we take it like we just did in that quadruped, where it was more or less about where the arms are, I want them to keep their upper body stationary. So I want them to think that their arms are gently pulling back to them and holding, and now they're just going to draw those knees in towards their body, their thighs move away from the blocks, and then the carriage goes back and their thighs come back into the blocks. And as you come in, ladies, just bring those knees underneath your hips. Don't worry about going past that point. As you continue, I want you to have a little less arch in your back. Right there. Maintain that. Right there. Keep that good lift. There you go. So as they're going back and forth, they're being able to keep that upper body static while they're allowing their legs to move back and forth. But what area are you actually feeling work here, ladies? Upper body and tummy muscles. So there's a lot more going on in the belly than what somebody thinks. This is kind of one of those other exercises where you can't, if somebody still cannot feel that they have belly muscles, this is a great place to go, because all of a sudden they don't have any other choice but to use them to help bring those legs in. Now they can keep their legs back behind them, walk their hands a little bit more forward. Now we start moving the trunk around our arms. So now they actually are going to pull with those arms and allow themselves to reach back. So they're in a more of a parallelogram shape versus a nice box, but just being able to add movement to the exercise. So now we're getting that sense of pulling those arm straps by our side that we did in that same supine arm series. This is the same thing. We're just weight bearing now. And just being able to use that exhale and inhale to move back and forth. Good. You all can pause. Thank you. So the idea of the reverse abdominals, same concept as the mat. Now we're putting that movement component to it. So now we move on to a seated position. So when we start seated, all of a sudden we may not have, and we're looking at seated without back support. So now we're trying to say, okay, well, what is that person, what are they aware of in their alignment to be able to do the exercise? So we do this rowing series on the reformer, but you can do the same rowing series on the mat, and you just add some weights in the hands or no weights. But what does that person now need to know about where their body is when they're on the mat, when they don't have anything behind them? So as we do the rowing series, no matter where you put your arms, no matter what movement you might be doing and how you might be changing that arm position, is that person allowing something else above or below to lead their arms in a certain way. And we want to make sure we keep that good length. So let's have everybody go ahead and stand on up, because we can do our arms with this rowing series without sitting. So what I want everybody to do is take their hands and bring their fists together right in front of their chest. Good? Now we're going to go ahead and take your right foot and put it in front of your left, so we have a little bit of a split stance position, so we can end up having a little bit of a roll back. So you're going to take a nice inhale. As you exhale, imagine you're going to roll back to that left leg, so that left knee is going to bend a little bit. Stay here. So now you want to feel like we have this long C curve in your spine. And if you don't have this C curve, you're going to end up collapsing, and then you're going to feel like your body is really rounded forward. We should still be open in this front of the body. Now gently open those arms out to the side, and as you do so, just be mindful of your neighbor. Rotate those hands to be thumbs down to the ground. Now just do me a favor and rotate them thumbs up. And then rotate them thumbs down. Nothing else should have changed but the arms. So if you rotate them thumbs down and you end up rounding more and collapsing, that puts your shoulder at risk for injury. If you can rotate them and you can keep this long C curve, all's good. Okay, and then carefully come back on up. Okay, so let's have several people sit onto the mats. And we'll sit on the mats facing towards the screen. And just go ahead and sit, and if sitting in a long sit position bothers you, go ahead and bend your knees. But now take your hands so your fists come in towards one another. Take an inhale to be up tall. Exhale, gently bring your pubic bone towards your belly button and roll just off of your sits bones. Now stay right in here, and Tina, let your head come back a little bit with your body. Good. Now stay here, everything stays the same, just open those arms out to either side of the room and rotate those thumbs, thumb down towards the floor. Stay there, just rotate now those thumbs up to the ceiling, and then bring them down towards the floor. Thumbs up, thumbs down. I want you all to watch their shoulder blades. Their shoulder blades should be doing nothing when their arms come up, when their thumbs go up and thumbs go down. Shoulder blades should stay because the arm is no longer elevating, it's just rotating. Now, thumbs are going to stay down. Now their shoulder blades will end up moving. You're going to press your arms behind you as you round your body up and over forward. So you should see their shoulder blades change. What you shouldn't see is that they're pinching so far together that now their arms are stuck behind them as if they were puppets, that their arms can still reach into that extension. So I want them to allow those arms to lift as high up to the ceiling as they can, open them out to the side, circle them around to the front, bring those hands back together, and sit up tall. So I'm going to have them do that again. They're going to inhale here. Exhale to gently go ahead and roll back. Stay here. Gently take those arms out to the side, thumbs are down. Now as you round forward, draw those arms back behind you. Let those arms lift up towards the ceiling, open them out to the side, watch those shoulder blades come around, and then carefully stack back on up. Now I'm going to have them do it wrong. So I'm going to have them basically kind of compress their back a little bit. So only go as much as you guys feel okay. I don't want you to put your bodies in danger. So when you roll back, I want you to actually get shorter. So roll back and feel like you sink. Okay, now take those arms out to the side. Already, look where their shoulders are. Now round forward and press those arms back behind you. Let those arms lift up towards the ceiling and circle around and come back forward. So they could still do it. So they could still do the choreography, but the quality and the control were lost based on the fact of that change of what their spine did. So we changed how that thoracic spine was able to move, and all of a sudden we put that pressure right in there. Okay, so knowing that same setup, how does that person need to move and where does that happen and as those arms move? And so knowing that you can stay in this T position and be able to move those arms and not feel this sense of those shoulder blades, it's a great practice for that person because thumbs down is internal rotation, which tends to go with rounding, which tends to go with compression. So all those things, we've set it up for a position to be challenging so that individual just to be able to go there and have those arms here and not compress, we're really having them have to think about a lot of different elements. So rowing in itself has a lot of different elements to it, but knowing where that arm goes and how it fits in the socket there. Okay? Thank you, ladies. Now we can take the exercise salute. Now we could do this without the reformer or shave head. So the idea of salute coming more towards the top of the head or your forehead versus a shave head, that person has to have that range to get there. So that's the difference with that shave head. This does not mean they have the range to get there. Okay? So people will want to because they want to be good students and they want to do the harder thing. So they'll make it and they're like, yep, I got it, which is what I'm doing in that second picture. So the idea being is that where those arms are, so that we can sit, we can be in tall kneeling, we can be on a box. I just happen to be in low kneeling just to make for the picture. So if you all want to put one blue on. And you can be in whichever position for salute that you want to be in. I want you to do salute today from the top, from the crown of your head. So go ahead and grab your little loops. Allow those arms to circle around. And as you're here, now the difference with salute, you're going to have with those arms higher, you may have a little different inclination of the torso compared to the body. So depending on if they're up or they're down, so you can see Haley being down and me in the picture being down, my shoulders are in front of my hips, but my rings are not in front of one another. Do you see that difference? So versus the second picture, you can see how my rib cage ring and my pelvis ring and shoulders are no longer lined up. I just took my rings from the vertical and shifted it slightly forward. So I kept that position. So they're going to exhale to lengthen out their arms, keeping those hands touching one another, and then inhale to control it back on down. So again, no input of where their body is in space except for what they're connected to on the reformer. but then being able to allow that freedom of movement for the arm. So the shoulders moving on the socket, socket moving against the trunk, and having all of that movement go. So this is a great place where you can watch for that client and see what's happening in those shoulder blades. The arms are already elevated, and they're elevating a little bit more. So we want to see those shoulder blades go into that little bit of upward rotation as they lengthen their arms. If it doesn't, then we know that their shoulder might be sitting incorrectly in that socket. And you all can open those arms and lower them on down. So we can take any arm work and do the same thing with it. Just happen to pick that one because there's so much elevation with the arm in that movement. So the same rowing series we did on the mat, you add the resistance to it. But all of a sudden, if something's off on the mat, and then you add a movable surface with these straps that feel like you gain and lose tension potentially, it makes it a little bit more difficult. So knowing what's best for that client at that moment and to be able to get them to be successful with the movement that way. So then we start talking about a standing position, doing arms in a standing position and looking at that shoulder and standing. So we've already talked at the beginning about where we place the body and how we can take those arms by our side. And just remember, standing for some people can be more on your knees, like we were just doing on the reformer, versus standing, which can be a balance challenge for some people all in, because maybe they just don't have very good balance on their feet. That being in a kneeling position can work as well. So I'm going to go ahead and hand out some towels. Okay, so what I want everybody to do, we're going to go ahead and just stand up, and I know I don't have enough towels for everybody, but we'll kind of just go through the kind of movement. So with the towels, I want you to go and fold the towel in half. So you're going to take the two ends to touch one another, and you're going to take the other looped end. You're going to take the one looped end and get it to one side of your shoulder, and then you're going to take the other end, so you're going to bring it here, and then you're going to walk your hands up so that you're holding at the end that's doubled. Now let go of your loop, and then hold on to your towel. And what's going to happen is now you're going to hold on to the place one in either hand where your hand was. So what you just end up doing, what you found out was double your shoulder width. So we take the looped end to one shoulder, hold on here, now let go of the loop. Now take one hand on one side, the other hand on the other. Yep. So now you're holding on to the towel double shoulder width. So Ron Fletcher developed the towel, and I've had this reconfirmed from Kyria Sabin, who's the director of the Fletcher program. He had the ladies that lunched in his Beverly Hills studio. So Ron Fletcher left New York City with Clara's blessing, and he went to Beverly Hills and opened up the Ron Fletcher Studio of Body Contrology. So he trained directly with Joseph Pilates, worked a lot with Clara, and goes off to Beverly Hills. So he had the ladies that lunched in Beverly Hills, and he was getting very frustrated, as his background being a choreographer, that they weren't doing and looking the way he wanted them to do. Every time he'd fix one part of their posture, something else would go wrong. So there was a towel sitting on the floor or something. He twirled it around and said, "Hold this." And the lady held it, and all of a sudden, her upper carriage stayed how he wanted it. And he's like, huh. That's kind of interesting. And so then from there, his background being a choreographer, he then developed a multitude of work based on the towel. So it became into a braided towel, and it went through many, many variations to finally get into what it is today. And red was always Ron's signature color. He would have everybody would be in black. Whenever he would be teaching or that, he wanted everybody to look the same. Just if anybody's been in the dance world, that's kind of that sense of like you all look alike. And then he started to do his red towel. So they've changed over the years a few different things here and there, but in the grand scheme of things, the towel is the same. So if you pull on it a little bit, you'll notice the towel has a little bit of give to it. It's made of terry cloth, so it has a little bit of give, but not so much give like TheraBand, where it's very like wee, swingy here. So there's enough to have some resistance, but you have enough to hold so you can work on grip strength. So when you're holding the towel, so everybody kind of standing on up, make sure when you're holding it that we watch our wrist position. If you hold your wrist back, you're going to feel it in your elbow. So you want to make sure that you keep that straight line of your hand. Then I also want you to hold harder with your little fingers than your index finger. So your index finger is still holding, but the little finger has more power. Technically, it's the weakest finger of your hand. But in this exercise, it should hold more power. So now as you're holding your towel in front, it's like a letter U. You're going to stand with your feet in a nice parallel position. Keep your weight about 60% towards the front of your feet. Balance through that ball of the foot. Heels are anchored. Oh, good. And then you're going to go ahead and take that towel, and you're going to take an inhale, and as you exhale, just make it taut. And as you make it taut, look down at your hands or look in the mirror. Make sure your knuckles are pointing towards the ground. With those knuckles pointing towards the ground, you're now going to inhale and let those arms come up to that breastbone height. Exhale, lower it down towards your body. And just continue that movement with a smooth breath up for the first part, and then let it out as you lower. And as you lift and lower, just get the sense of where you feel that freedom of movement and how holding on to this towel keeps your body in this nice, the carriage alignment per se. Now we're going to go ahead and come to the chest area and hold. Take a nice inhale. As you exhale, now bring it overhead where you feel best to go, that you can keep everything still in line. Inhale back in front of your chest. Exhale back to your thighs. Inhale, chest height. Exhale overhead. Inhale in front. Exhale lower. Now we do it a little quicker. 2 inhales on the way up. It's a down, up, down, last one. And gently let your towel come into a letter U and just roll those shoulders. So you should feel at this moment, your shoulders should feel kind of warm. And we really didn't do that many exercises. So this really helps to set the shoulder into its socket and allow a lot of those rotator cuff muscles and the rest of the shoulders around, the rest of the muscles around your shoulder to work. So it's a great tool to use for clients that aren't quite sure how they're supposed to lift their arms without holding on to something. And it gives them that sense of, oh, I do have muscles in the back of my shoulder, not just between my shoulder blades. Because a lot of times people can't determine the difference between one versus the other, and that's where we want them to feel. So there's a lot of range of motion that you can do with the towel. There's a lot of exercises, and there is a licensing where you can go through and learn all the towel work through the Fletcher Pilates program of study. But there's a lot of nice things you can do with the towel per se. If you were to use Ron's red towel, please give him credit. If you are using another band of some sorts, it's no longer Ron's thing. If you're using it with a stick, it's not his thing, but you can do those same concepts. And so you can say it's Fletcher, Ron Fletcher inspired from there. So we give him credit for his work. Okay, you all can sit, and we can just kind of throw the towels to the side. So the last element is breathing. How does breathing affect the shoulder? So if we look at this sense of breathing from this 3-dimensional space, so when I call about the 3-dimensional space, we're talking about how the diaphragm works. So just to kind of remember that image of the diaphragm, that the diaphragm sits in your rib cage like a correct umbrella. When you breathe in, it's a flipped over umbrella. When you breathe out, it goes back to a correct umbrella. Well, if you were to walk out in a rainstorm and had your umbrella upside down, what would you collect? Water. So the good news is in the body is that by flipping the umbrella upside down, we collect lots of air because we've changed the pressure system outside our body versus inside the body. Air wants to move to negative pressure. So when you inhale and you end up creating this kind of negative pressure system, the air's like, woo, good, I want to go in there. And then when you exhale, it comes back out. So I want everybody to just take an inhale through your nose and just open your mouth. Just don't do anything else, just open your mouth. What you should notice is you are exhaling rather slowly, but your diaphragm is relaxing and it's pushing the air out. Not super efficient, but it works. So just know that that system still works. We breathe to get rid of carbon dioxide. We get oxygen in return for breathing, but we breathe because the blood gases do not want to get the carbon dioxide too high. So we don't necessarily need our other muscles when involved in getting that air to come in and go out, but the other muscles definitely really make it a lot more efficient and allow us to work a little harder when it's helping the diaphragm to move. So the diaphragm ends up connecting to multiple systems of the body. So we know it's part of the musculoskeletal system because it is a muscle. We also know it's part of the respiratory system because it helps with breathing. Then it connects to the cardiovascular system because of that, because those two systems are so closely related. It's innervated by a cranial nerve. So it's part of the central nervous system. So it has that direct connection to the brain. So it's innervated by the vagus nerve. The two newer research things that link the diaphragm, they link it to the immune system, and they link it to the gastrointestinal system's function. So when you inhale, if you think about how what that diaphragm has to push against, pushes against all your gastrointestinal organs. When you exhale, it releases that pressure. So in a sense, it's always massaging them. So it kind of helps with that function going through. So somebody, and I've had patients over the years that they just don't really have good bowel movements. It just doesn't work well for them. But they start breathing better, and all of a sudden things start functioning better. And so now they're kind of like, oh, I never really thought I would ever have a normal bowel movement. And then they start to change potentially. They look at what they're eating because they never thought it was anything they were eating or other things because it was always bad. So then they start changing other things and things start happening better in their system, but really from that foundation of breathing. So ideally we get people that come in and they have to start breathing from somewhere. Most of the time when people come in, especially if they're in pain, they're breathing from their accessory muscles. They're breathing all from up here. They're just kind of, everything's here. It's the littlest part of your lungs up here. So you can't get that deep of a breath up from in here. So we want to get them to start breathing from their diaphragm. Now when somebody is lying down on their back and sleeping, and if you've ever watched a baby breathe when they're sleeping, they breathe purely from their diaphragm and their belly goes up and their belly goes down. If we're in a relaxed state, that is exactly where I want people to breathe. So if somebody were to video you sleeping, that's what I would want to see. The difference is when we're working, if we have that all the time, then we have no control of what's going on in the trunk muscles. So that diaphragm moves along this entire rib cage as a basket. So knowing that we have that basket, we want to be able to have that inhale and exhale. So the hardest thing to teach people is how to breathe to the back. It's easier to start getting them to breathe to the front. Then we can get them to breathe to the side. And the worst is to get somebody to breathe to the back. So that's what we're going to practice today. Okay, so partner up with a different partner, please. And what I want you to do in this, one person's going to come from behind. You can sit, you can stand, and I want you to go ahead and bring your hands around that person so you're around that rib cage, so your thumbs are to the back side of their rib cage. So your hands are, that web space is towards the side, your thumbs are towards the back. Okay? So now what I want you to, as the person that's being touched, that means you're the breather. So I want you from here, I want you to breathe in to your person's thumbs first. So try to breathe to where their thumbs are, and then let the air out. And take your mental focus to breathe into their thumbs, back here, and then let it on out. And then breathe into their thumbs. So you have to think behind, 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 and then exhale back on in. Feel like you got more room to breathe back there, Miss Kathy? Mm-hmm. Breathe in, and let it on out. Now, if we teach that person to breathe back here, think about when they're in a curled position in the 100 and they're breathing in. Think of how much help that is to hold that position, that it's no longer about holding their head up. That inhale actually becomes, whew, good, I can stay up here, and the exhale makes it harder to be able to hold the position. So just being able to teach somebody to breathe further back makes a big difference. And then as they're breathing to the backside, watch what happens potentially to their upper quadrant. So to go ahead and breathe in towards the backside. Nothing really should change. But if they breathed from the accessory muscles, so now try to go and just be a neck breather, watch what happens to that upper quarter. It all has to go along. So being able to know we want that breath to be down lower and be able to get that breath from there. So now go ahead and switch partners. So the person that's breathing, you want to breathe to their thumbs first. It takes a lot of mental focus to change. So breathe to the back side of your body. And then let the air out. And breathe to the back side of the body. And let it on out.
How would you control excessive like this?
This. Then it's just making sure that they're not pushing their body to go through. So that they're not trying to breathe so hard that they're taking their rib cage down.
Okay.
Yeah. That there still has to be movement out to the side. Okay. There still has to be some movement to the front. Okay. So it's not just that way. Because the idea of the diaphragm is like a big circle. So Exactly. Not letting it just be one way. So if you were trying to teach somebody and they were just doing it to the side, this is what you would feel.
Okay.
And now if you want them to get towards the back, you want them to feel this.
More expanding.
It's getting bad. It's getting a little bit bad.
Yeah.
Stiff at first.
Okay? Yeah, it's definitely, it's a very hard place to access if you've never thought you could breathe there. Most of the time people always think of this and then forgetting that the largest part of our lung is to the back and the lower part. So if we breathe here, we're really getting that whole internal shower. We're really getting that whole filling up those lungs and letting it all out. So I have a little self-practice slide on there with some self-imagery on different things with diaphragmatic breathing from in there. So it's a place to practice. So a lot of times I give that posterior breath component to patients and clients when they're seated in their car. So when you're at a stoplight, because the seat is right behind you and you can breathe right into that seat. And so you can feel it happening. And then they will feel if they're breathing and slouching because now they can't see what's in front of them anymore. So just being able to get that breath all around. So Shannon had a good question to me. She's like, how do you get them to not collapse? And it's that reminder that it still is a cylinder. We want it from all sides. We don't want it just to the back or just to the front. That way. Okay? So we'll take a little pause because we've now completed the shoulder.